Civil society organizations and their coalitions play an important role in the budget-making process. CSOs have a mandate to represent community priorities and influence resource allocation during the annual budget cycle at the county and national level.
We know where to start because it starts exactly at June. So from June, public participation, we must be there to see how it is to implement the budget. Then after that, we follow up and see whether what was implemented, is it true?
The health budget advocacy trainings have given CSOs the skills to identify an advocacy issue that they want to champion.
One of our major asks as Stage Media Arts was to ensure that the county government allocate money for reproductive health and youth-friendly centers.
We participated on formulation of the budget, the CIDP, in terms of giving and recommending to the county government what are the key strategies, what are the key programs that wanted to be captured in it.
I was always on the ground complaining to the MCAs, telling them why aren't we having these services at our public health facilities. So I used to approach the policymakers such as MPs, MCAs, asking them why?
Only 110 million had been allocated for drugs in Bungoma against 1.6 million people. We picked that issue and prepared the community champions to come up with the memoranda. So actually those memoranda emerged right from the community.
By working in partnerships and coalitions, CSOs are better organized to address issues facing their communities and champion for increased resources.
We identify different stakeholders in terms of civil society who we could join hands together and be able to amplify our voices.
Presenting budget memos is one of the ways they are able to make their voices heard.
I never thought in my wildest dreams that just an individual can, or a group of people can write what they want the county to do and present it, and it will be taken into consideration.
As an individual today, I'm quite happy. The government has realized that citizen voice is very, very important.
We hope that the government is going to focus more, because when you invest in people's health, you get to realize more and more benefit and growth to various areas that the country depends on.
As Kenya makes steps towards universal health coverage, CSOs have a key role to play.
So ours is to see that the budget's not going down, and ours is to follow up.
When we come together as one, this is when actually we can speak one voice and our voices can be heard.